Happy Wednesday, folks. It's October 2nd, 2024. Q4 has begun. We're here with some members of the Ovadia Heart Health team. We have nurse practitioner Lisa Simmons, who works side by side with Dr. Ovadia. We also have Cherish, her practice manager, who runs the whole back end. And here is Dr. Ovadia himself. And in this call today, we're going to talk about what Dr. Ovadia's team does in the telemedicine practice, how that differs from the regular PCP kind of experience you might have normally had, when you should go look at telemedicine, when telemedicine might not be a good fit for you. And you're going to hear some stories about some of the transformations we've experienced. By the end of this live stream, you're going to be in a better position to know if sticking with your insurance provided PCP is the complete solution to your problems, or if it would be wise for you to go ahead and talk to our team. And so let's get started here. And I want to start here with you, Lisa.
Sure.
Can you share with us a little bit about before you joined Ovadia Heart Health? Can you join us? Can you share with us some of your institutional experience, the kinds of environments you were working in before joining Dr. Ovadia?
I've done a couple of things. I was mainly hospital-based, so I'm an acute care nurse practitioner. So that's my main background. So I worked in critical care, including CCU and most of the ICUs as well as ER. And then I also have worked in clinics. So I did hormone therapy for a couple of years. I did it actually virtually, but I also still do that locally with the clinic. So that's my main background.
With that background, what are the most interesting or salient differences for you between your work at Ovadia Heart Health and your work in the hospital setting?
Oh, at Ovadia, it's the best. And I'm not just saying that. I like the fact that we really truly are getting to the root cause of what's causing people's chronic illnesses, and really looking for when we find the root cause, finding things that the patient can actually do for themselves to combat those and reverse or better treat those chronic diseases.
Why is that different than your experience in the hospital setting? Because everyone in hospitals is trying to help people get healthy, and they're educated and they're diligent, hardworking, work long hours with the best of intentions. Why is what you're experiencing at Ovadia Heart Health different than that past experience?
In the hospital setting, you're treating people that already have chronic diseases or issues, and that's why they're hospitalized. So it's different from Ovadia because we're actually looking for things. If they have a chronic disease, we're looking to see how we can better reverse it, give the patient the power back to do things through their lifestyle to make things better. Where in the hospital, we're just kind of treating things enough so that we can get them to be well enough to go home. It's just fixing the problem at that moment in an acute setting. But with Ovadia, we're actually looking to get to the root cause and reverse those, and in some cases, people are really now looking to prevent. So it's not always in the case that they already have something going, they want to be able to prevent it.
It's interesting. It's a discharge-oriented tour versus a health-oriented or longevity-oriented, something like that. Let's go hear from Cherish here. Cherish, you don't have a lot of fancy letters after your name. You just support all those people and make sure that everyone gets the care they need who walks through our door. I'm curious, from your point of view, for the people who show up asking us for help, what would you say, or you're saying, is the biggest difference between the insurance company provided PCP experience and what people are now getting from us?
Well, we treat people. That's the biggest difference. When I go into my PCP's office, I am a diabetic, or I am a person who has Hashimoto's, or I am this. I'm treated like my disease. We don't do that. We look at people as people, and that is the biggest difference that I see between our standard sick care model and our model at Ovadia Heart Health. Everybody's an individual, and your situation may be different than the next person's situation, and everybody is evaluated on where they are, not just by a diagnosis. Does that make sense?
It does. I remember being in an ER once, in this huge long line of people hacking and coughing and looking like death warmed over, waiting to get to the front of the line, not even to get treated, just to get to the front of the line. And there's this factory setting aspect of, you have all this staff that's overworked. There's not enough people. There's not enough beds. It's just a standard ER experience. And I'm curious, for Dr. Ovadia here, it sounds from what Lisa and Cherish are describing, this is completely non-scalable. why would you, a surgeon who has done thousands of heart surgeries that are sort of a templatized way you go about doing that, why would you choose to go and do something that's non-scalable?
Yeah, great question. And really it was because my calling as a doctor is to help people in the best way that I know how. And that is that's what drove me to launch Ovadia Heart Health. And quite frankly, I think most other physicians would think what I'm doing is crazy. I'm a heart surgeon. I'm supposed to do heart surgery, and here I am trying to help people not to need heart surgery. It really doesn't compute in the standard medical approach, in the standard medical model. But that drive, based on my own personal experiences at first, around my health improvements. And then as I, started seeing friends and family that would have similar improvements with this, that drive to help people in the best way that I know how is really what drove me to launch Ovadia Heart Health. And you're right, it's not easy. It's not as scalable, although we are certainly working on ways. This practice has continued to grow quite nicely, and we're still able to deliver that high level care, that personalized care that Cherish and Lisa talked about. And we are figuring out how to make it happen. We are revolutionizing the way that healthcare can be delivered in many ways. We are doing many things that are outside the box for healthcare. And our overarching principle, our overarching goal is to make sure that people get that personalized care that they need and are looking for.
But there's over 330 million Americans, over 700,000 Americans die of heart disease each year. And you're not even a drop in the bucket. If people can't replicate this model, what you're doing is really as non-scalable as it sounds from what Cherish and Lisa are saying. What's the point when you can't help most people?
Well, I think it's scalable in the sense of we teach people, we empower people to take charge of their health, and then they can actually empower others to do the same. And one of the most powerful things we hear is when one of our patients' spouses get improve their health just based on what we've kind of taught the patient and done with the patient. Honestly, I'm happy when people don't even need me as a doctor, right? They can go read my book. They can go read Stay Off My Operating Table and learn the principles that we use in the practice. And if they want to do that by themselves and they get great health results from that, I'm very happy. It's stay off my operating table. Honestly, it's also stay out of this practice, right? We'd rather people not need us. But we know that there are lots of people that need us. And Brian, my business person, is having a heart attack himself right now when I say that. But that's what we're about here. We're really looking at innovative ways of delivering things, doing things sometimes in community group settings, and figuring out ways that we can continue to serve the people that want to be served in this way.
I want to dive into that story about spouses and spouses experiencing a benefit here. So let's go here. I want to hear both from Cherish and Lisa. Can you share with us each a time where one of our patients, you heard about some kind of outcome for a family member, for a spouse, for a friend, or for a neighbor that we could not have predicted, but we were sure happy to hear about it when it happened? And no, folks, none of this is prepared, which is why the staff is now thinking about what can they actually share, because we can't share most of our success stories.
I mean, I can share a personal anecdote, and it's not a spousal anecdote. It is a personal story of, coaching my mother-in-law, who was extreme sugar addict. I mean, really bad. She still is. Once an addict, always an addict, for sure. But she was able to, within a year, get off of all medications and reverse her pre-diabetic state just by lowering her carbohydrate intake and focusing primarily on protein and fat. And that was all done. She pretty much was mostly carnivore at that point. But she did it by using a CGM, which is something that we recommend in the practice that Dr. Ovadia and Lisa will prescribe for our members. Now you can get them over the counter. So I highly recommend that. That's going to help you see exactly what effect the things you're eating are having on your body. And it changed her habits. And so then she lost weight and her blood pressure came down.
What's
and the
one
next
specific?
thing,
What's one very specific thing that she changed once she had that information?
oh, she started just eating bacon and eggs. That was her primary food. So she cut out
what was she doing
all
before
candy,
what was she doing before she ate bacon and eggs for breakfast?
all the normal things, all the
Standard American diet,
normal
waffles, maple
standard
syrup
American
everywhere.
diet. Yes.
Coffee
Biscuits,
that's mostly sugar.
gravy, grits, all of
Biscuits
it.
and gravy sound fantastic. Thank you. Grits. Morning, folks. You're going to leave these calls hungry. Okay. So your mother-in-law used the CGM, and then because she had more information, changed her behavior around breakfast and other things, and then had some different health outcomes there. Lisa, can you share a story about an unexpected outcome from someone related to the practice in some way?
Oh my gosh, trying to think of any. We have quite a few that are doing really well. So the ones that really take it, and run with it. And there's so many, I can't think of a specific one. I actually have a specific one in mind, but he is very, very involved and really does everything that we tell him to do. And he does it. And he just has just a thirst for, or even a hunger just for, and it's a run on words, I guess, but he really wants to learn more. And when we come up with resources or things that he can go read or learn from, or videos or whatever, he's watching it the second we tell him what to go look at. And so just wanting to be active, I think that is the biggest thing. There was not really one thing besides obviously what he was eating and exercising and all of the lifestyle kind of things that we want you to do. But it was just somebody that really wanted to put the time and the effort in. I just think everybody now, we've conditioned them to take a pill, and they actually have a lot more power to change the course of their life if they would, choose to take that road.
You're talking about curiosity here, curiosity combined with work ethic or diligence, let's call it. And I want to go check in with Dr. Ovadia here about curiosity and how important that is in healthcare. But real quick, we have a comment here from Paulette watching us on YouTube right now, talking about, I wish my husband could get evaluated. And we have some specific things, and they're also waiting on getting even data, waiting on just getting data. And I wonder, Dr. Ovadia, before we talk about curiosity in healthcare, can you talk to Paulette here about what does the process look like? If Paulette's listening to this live stream and going, wow, this sounds like I would be a good fit. My insurance provided PCP, that system is not getting my husband the results that we need. We need more. What does the path look like to eventually be talking to you or Nurse Simmons?
Yeah, first step is to set up a call with our team. You can go to iFixHearts.com/talk, and you can get on the calendar with one of our health that can.
If anyone's noticed, Dr.
Our
Ovadia,
practice is like.
And he's back.
Yeah, sorry,
Dr. Ovadia's in
little,
Florida, which, as
post-
you may have heard, it having some connectivity issues in some areas. So we're very happy he's able to join us at all. So it's ifixhearts.com /talk.
There you go. Yep.
And you'll be talking to our team who will help evaluate whether we're going to be a good fit for you or not. Now, let's dive into a bit about curiosity. Lisa was telling a story about curiosity. And I'm thinking about how when I grew up, doctor's orders was the thing. You follow doctor's orders, and your job isn't to be curious so much as your job is to comply. Compliance over curiosity is how I grew up, and it's how a lot of Americans grew up. And in your stories of in your own health journey, Dr. Ovadia, you've come across that compliance is actually not more of a virtue than curiosity. Can you talk to us about how you use this idea of compliance versus curiosity in your practice to help people get outcomes different than they would get in the insurance-funded PCP program?
Yeah, and one of the interesting things is how that compliance over curiosity has been forced upon the practitioners as well, and curiosity among practitioners and questioning narratives among practitioners. We've seen some very robust attacks on that over the past few years, I would say. But when it comes to the patients, we need to understand that if you go back to the Latin root of the word doctor, it's an educator, it's a teacher. It's not supposed to be your doctor telling you what you have to do. It's supposed to be your doctor educating you on options, on your conditions, and working with you to decide, what you, the patient, decide is the best route to take for your health. And again, I think that's something very different that we do here, and something very different. I have a change that I have made in the way that I practice medicine because of that.
We're losing Dr. Ovadia again. So while we're waiting on that here, I'm going to go ahead and ask Lisa a question. Sorry about the connectivity there, Dr. Ovadia. We have a question coming in from the audience here, Lisa, about talking to Paulette here, saying, I'm playing the waiting game too. And I'd love to hear about your experience, Lisa. When someone signs up for an initial consult with Dr. Ovadia, it's usually 3 or 4 months until they're actually talking to him. In the meantime, besides talking to our health coaches and doing some lab work stuff, they're talking to you. Mm-hmm. And so the experience of waiting to talk to the doc, it's different at Ovadia Heart Health than at your insurance-funded PCP situation. Can you speak a bit about to that experience and what you've heard from the people that work through our program instead of their normal thing?
Usually when they're seeing me, they've already seen the health coach a couple times. So they really have a good, they are working through some of the lifestyle changes and seeing what the patient's already doing. And then, seeing if there's some things that they can tweak so that they can actually get a better understanding or getting better results than what they may be getting. And then I'm also able to see what the health coaches are doing. And then with that, I'm also making sure I'm gathering more information, making sure that we have all of their images, all of their lab work is completed, anything that they had done prior. And I talk with them. I find out what they're currently doing for their lifestyle, as well as what's the reason why they want to see Dr. Ovadia. But at Ovadia Heart Health, we are a team approach. That's why you see everybody within here, because we all are working together to get that patient to where they need to be. So, and then once I gather all the information, make sure that we're getting everything done, because I really want, by the time they get to see Dr. Ovadia, which he's super busy, I want to make sure that he has as much information as possible so that that patient gets a really thorough consult. So that's really what my piece is. But then I also get to know the patient myself. So then if when they do a follow-up visit with me, they're familiar with me, and I've gotten to know them.
I'm thinking about the 15-minute PCP appointment where you have just enough time to talk about a few details of what's going wrong before the doctor has to go tell you, do this, do that, take this, take that, stop doing this, etc. And I'm curious, Cherish here, you see the back end of all of our patients. By the time someone actually is on a call with Dr. Ovadia, how many hours of talking with our staff between working on the mobile app, talking back and forth, in a meeting one-on-one with Lisa, talking with our health coaches, how much time has the average person spent with our team talking with us so we get to know them before they even talk with Dr. Ovadia one-on-one?
Oh, that varies by individual. I mean, I couldn't even give you an average because some folks, they have different concerns, so they're more active in spurts. So if we just went strictly by like a standard healthcare model and just looking at time of appointments, they're getting, a couple 30-minute sessions with the coaches, they're getting an hour session with Lisa, and then they're getting an hour session with Dr. Ovadia, right? But that's not the only thing they're getting. We have an internal proprietary messaging app that only members that join the practice and those that sign up for a consult have access to the entire team that they can communicate through. And some folks like to communicate in there on a regular basis, sometimes daily. Other folks, they just post their questions in there and they wait for their appointments, and then they do a couple follow-ups, and it's a touch base maybe once every couple of weeks, but way more than what you would ever receive with a typical insurance care model, for sure.
Which brings us to the question of money, because most people are used to, you pay your insurance and then you take what you can get, what's available, and maybe you go and you complain about, oh, it's 3 months until I can see so-and-so. And then other folks you tell that to say, oh yeah, I had to wait 5 months to see my whoever for this problem over here. If someone's spending hours and hours with your team before even talking to you, Dr. Ovadia, how is that possibly economical? Are you running a nonprofit, sir?
We are not running a nonprofit, but to be honest, our model of care is certainly is more. There's more upfront out-of-pocket costs than the insurance model, but that doesn't take into account the long-term costs associated with the insurance model. One of the things the insurance model does is it hides the cost from the consumer, from the patient. And with the direct care model that we use, we are upfront about those costs, but we're also upfront about the value that you're going to get for what you're paying. Because if people really think about the value that they're getting through the insurance model, I would suspect that most people are unhappy with that. Working with our practice, we're transparent about it. There is an expense associated with signing up for our practice and having a consult that you're
And bad internet strikes again. Dr. Ovadia will be back shortly with Starling, folks. Continuing on that thread, I recently had the experience of my son has some health issues, and my mom says, well, are you going to have, does your insurance go pay for the specialist you need to see? And I said, Mom, no, we've exhausted everything the insurance company will pay for so long ago. We are finding people literally across the country who are specialists in the exact problem we have, and we have to pay them out of pocket. So even though we're spending as much as you can spend on health insurance where I live, that insurance does nothing for us. That's just money that's leaving before we start to actually go pay the health professionals that we need, which is not what I thought was going to be happening with insurance. So tell us, Lisa, when you talk with people, and maybe this is a better Cherish question, but what's people's experience like after they've been in a practice a while, they've seen how we're solving problems, how we're supporting them in solving the problems they came to us with, and they're looking at what they're paying us versus what their insurance experience has been. What do folks reflect back to you about the money part of things and not being able to use insurance to pay for us?
That's a Cherish question.
Cherish question. I figured it might be.
Well, I don't think you can put a value on your health. And I think that is part of what people figure out when they work with us, because what our team brings to the table is that you can't put a price on your life. You can't put a price on your health. And we all love to say these things, right? We all, like, everybody says, oh, well, how much is your life worth? And people will come up with these erroneous numbers. But then when it comes to the investment, it's like, oh, we've gotten so used to that copay model of care. And we're like, oh, we all do it. We all have that initial, dollar sticker reaction. I think if you just take time to think about it, I was just telling Lisa today, if I were to take a super bill or a hospital bill from a patient that has actually had a heart attack versus a patient that prevented a heart attack, I think you would see that what the insurance company is being charged and what is being paid versus your life not having that heart attack is immeasurable. Is immeasurable from a physiological, from a mental, from all kinds of standpoints, but from a strictly financial standpoint, preventing the problem is so much more worth than actually paying for after the problem. It's one of the most frustrating parts of my job, to be quite honest, because we do recommend testing, and we do still have to work with the insurance care model with trying to get those tests approved. And just the simplest little tests to try and help patients, sometimes insurance companies don't want to pay for it. So then we have to go look to see if we can find a cash pay option, because we know that if they just had the information, that there's something that can be done about it.
Dr. Ovadia recommends that everyone get a CAC at 45. If you have a family history of heart disease like me, you get it done at 40. So I went to my PCP, my insurance funded PCP, and I said, hey, I work with a cardiologist. He suggests I get a CAC. Here's my family history of dying young from heart attacks. What does the PCP say?
No.
No symptoms.
You don't need it.
No symptoms. Yeah. Not going to order it.
Frustrating.
And I think, but my grandpa died, not too much older than I am. What more symptoms do you want? And he said, no symptoms. I'm sure he used a more complete sentence than that. It was a clarifying moment of this thing that is actually known to kill men in my family. Mm-hmm. My insurance, like, not our problem, man. That was clarifying. Let's look at some comments here we're getting in the chat. So we have Chris here talking about fired my cardiologist, and the heart problems are from adrenal glands and not the heart muscle. Dr. Ovadia, it looks like maybe your connectivity is better now. How do you, and you're a heart surgeon, so of course you focus on the heart. How do you know, and how do you judge when to go look in places other than heart-specific problems? And given that your focus is doing the whole heart surgery thing, how do you know when to recommend people look outside your practice to get the help they need versus the team you've built inside the practice?
Well, we are always looking outside the heart. We realize that the heart, what's happening in the heart is a reflection of what's happening in your entire body. And that's what, again, is different, looking for root causes, talking about metabolic health, and all of the ways that it affects your heart and everything else in your body. So again, a difference here in, yes, I'm a cardiac surgeon, and yes, the practice is called Ovadia Heart Health, but the heart isn't our only focus. We are delivering holistic care, looking at what is causing your heart disease. And again, it's like Chris commented, that's oftentimes something not in your heart. The end effects are on your heart, but we got to look outside the heart to find out where the problem is coming from.
Let's look at some more of the comments showing up here. Looks like Dr. Ovadia's internet's also going down again. We have Edric here talking about a LinkedIn saying it's also the quality of life in terms of not having a heart attack. We have Bromwell here saying, just received a bill for my heart attack, $195,000. Compared to that, work with Dr. Ovadia, cost almost nothing here. We have Edric here again talking about feeling better every day. Lisa, can you speak from the experience you've had working with our patients about their difference in their daily felt perception of well-being from working with us?
Oh, so they feel great, which is, it's fun to actually talk to patients that really feel good. And they want to get off medicines. They don't want to go to the doctor and get more medicines, and they want to know what they can do and be an active part in their own healthcare. So for the most part, it's, when they work with the health coaches as well, and with myself and Dr. Ovadia, we're all kind of, again, as a team, we're looking at, okay, well, we look at whole lifestyle. So we obviously we really base it on nutrition, exercise, stress, and sleep, because I think, one thing that is really overlooked a lot is, again, the root cause and figuring out what is, causing your issues. Stress is a big one that people don't really pay attention to. They always think that they're able to handle all of these things that are being thrown at them, and they can't, and their body says so, right? Through a lot of inflammation and things like that. And then but most of our patients, when we see them, they feel good over in the overall, and they sleep well, they are exercising, they're eating well, and that says a lot, right?
I got a massage today, and afterwards saw my wife, and she says, "You look well rested." I said, "Really?" And apparently, even a little bit of time, slowing down just a little bit. And really, how often do any of us slow down? My son's 11 months old. There's not slowing down involved. There's sleep, there's lack of sleep, and there's more lack of sleep. Those are the two basic things, right? And my excuse is a small child. But many of us, our work is demanding, our health issues are demanding. We can't really take the time. We don't have the time to slow down. And I'm curious, Cherish, from all the people in our practice you've talked to about stress and slowing down, and what, because you see a lot of what our health coaches talk about with people in those initial visits during an initial consult where stress comes up some of the time. Do you have any idea? Can you estimate for us how often in those first couple of meetings with health coaches are people talking with the health coaches about the stress in their lives?
It's part of the actual complete package when you talk with a health coach, because it does, like Lisa said, it does impact everything. So it's something that most people do have to focus on, and our health coaches are experts at helping folks manage stress. Lisa and I, Dr. Ovadia and I, we have all talked actually internally. You've been on team meetings where, as a company, we talk about managing our stress for our employee health, right? So, yes, it comes up quite often.
When we hired Cherish here, you remember Cherish, part of our first conversations there was, so when are you taking time off to go take a massage? Because you're going to be the practice manager of a fast-growing telemedicine practice. You better have a game plan for taking time off to recover. Otherwise, you're doomed, because the speed of this company is not going to slow down. We have one of our health coaches here watching us on YouTube. Krishna Hanks says our patients become their own coaches, educate and empower. Yeah. Krishna is also our director of employee wellness. Well, that's not the focus of our conversation today. If any of you out there are in leadership or own a self-managed or self-insured, your pay your own insurance, one of those kind of companies, go ahead, reach out to us at ifixhearts.com/talk. And Krishna will be able to have an interesting conversation with you. Now, Chris here is saying, I'm on information overload. Let's break that down. And Chris, feel free to toss more in the comments there about what exactly you mean. But Dr. Ovadia, you hear about information overload and information pollution, where people are just getting bad information from a million different sources with unrevealed financial incentives from all different kinds of areas. What do you recommend to people like Chris who come to you and say, I don't know what to do. I've been reading everything. I've been studying everything. I don't know how to get to where I need to go.
Yeah, I would say that's where you need to partner with a team like ours to help you sift through the information. And it is challenging, right? Because in healthcare and in many other different areas of our lives, we have access to all of this information now. And you can basically find information that's going to support almost any point of view on healthcare. I mean, there are people out there that are saying that processed food is good for you, as unbelievable as that sounds. And how do you figure out what is the right information? And partnering with a team like ours, I think, can help you do that. And then, seeing how you respond to the recommendations that we make. I think is very important. And you know, apply this to your other physicians as well. Are you happy with the results you are getting from your current physician? And if the answer is yes, then, you know, you probably don't need us. But more and more, I see that that answer is no, and people are unhappy. And in my heart surgery part of my my heart surgery world, right? It's one of the most common questions I get asked. You know, why am I ending up on your operating table? I've been following all my doctor's advice. So these are the things that you need to be considering, when you're evaluating whether working with a team like ours makes sense for you or not.
Here's a follow-up from Chris here about some of the details of what she's facing, information overload. When I see all that, Chris, what I think is, yeah, that having someone with a broad knowledge of things that understands that everything's connected to everything else, and then having enough time to talk with them, like in the case of part of our initial consult is you talk with Lisa for an hour after talking with health coaches so that you can have a conversation about, well, is this connected to that? How is this connected to that? And then, oh yeah, Chris, you hit the nail on the head right here. Doctors wanting to treat each thing individually. It's a big problem that our people take care of. Let's look over here. We have apparently one of our patients is here on the call, one of our clients. Every time I meet with Kristen, we discuss stress, mental stress, physical stress, tools, how to relieve it. Can you talk to us, Dr. Ovadia, about, for the people that join the practice, besides just talking to Lisa and you about the more acute medical things, how are people using your health coach team to go talk about things like what this person is sharing?
Yeah, our health coaches are an integral and in many ways the most important part of the team. And most of our patients are meeting, with the health coaches more often than they're meeting with Lisa and I, the medical practitioners. And there's a good reason for that, right? The health coach is the one that helps you to implement these changes into your day-to-day life.
Always happens when he gets to the good stuff.
I know, it's the good stuff. It's the good stuff. Cherish, maybe you can pick up where the impacts of the hurricane have stopped Dr. Ovadia from sharing with us.
Yeah, so absolutely what Dr. Ovadia was saying there again, it goes back to what Chris mentioned before, and Brahm Whale is supporting it, that when you come and work with our health coaches, they are working with you, not a carnivore, not a keto person, not a ketovore. You know, they don't put you in a box. They treat you as a person. You have real life issues, and they're there to help be your advocate and navigate through any obstacles that you might have that are keeping you from your goals. And it is huge to have somebody on your side that has an intimate knowledge of health, well-being, as well as all the factors. Like Krishna and Jen, our health coaches, have been doing this for decades. So they are just a wealth of knowledge, and they are able to come up with some very creative ideas as to how you can make the things that we're recommending, that are being recommended to you, sustainable. Because I think that's the hardest part for most people, is sustaining a lifestyle when everybody else is doing the standard American or normal things.
Yeah. I'm thinking about a conversation I had with Lisa about my lab work and about how I was looking at all the standard stuff. And Lisa said, well, what about this over here? This right here might explain this over here. So you should get this thing looked at because these dots might connect. Maybe not, but maybe they will. And this, I never even heard of this particular lab test until Lisa said, consider getting this done. And now on the path to going and getting that done. And then Lisa will be able to look at that and say, these dots connect, or no, these dots don't connect. But being apprised of things that may or may not be connected, it's incredibly valuable. We get questions like this that showed up on almost every live stream we do. Lisa, can you speak to, when we get specific questions like this, what is the context in which you or Dr. Ovadia, for legal reasons, are able to go and answer this kind of question?
They would have to be a patient of the practice if I could.
Why?
Because
why can't you just answer? It's a simple question, right?
Because there's more to it. I can't just answer this question. Like, I really don't know. So again, when we're looking at all of these things, there's more to it. Well, you would want lab work. I would want to know. And Dr. Ovadia, actually, during his consults, he will get the images. If you send the images to him, he will actually go over your CAC scan with you on the screen with you, so you can actually see where the blockages, where the plaque buildup is. So it's just, again, it's educating, right? Because that's what doctor stands for. So, and it's really letting the patient see and reassuring, but you have to have more information than just what's on the screen right here. So
we disappoint people every live stream we do because we don't answer specific questions. But then when you think about how many hours of time goes into even that first time you talk to Dr. Ovadia, and by then he has all your lab work and your CAC and everything else, and your CGM perhaps to go look at. It's hours and hours and hours, which is very foreign to those of us like myself who grew up in the standard American medical system, where you see your doctor when there's a problem, or if you're old and have ongoing problems. Otherwise, it's just a completely different kind of model. We have Edric hopping off here. Yeah, things like this are happening. Dr. Ovadia, you're not the only telemedicine doc who's sprung up recently. Can you talk to us about when you say you hear things like this are happening and you think about RFK Jr.'s Make America Healthy Again speech that was only 3 or 4 weeks ago, and yet it was the first time in my lifetime I've noticed someone of that level of prominence actually saying we are sick, and saying it out loud from a high platform and saying we are sick, it's a problem. You combine that with you, and there's a variety of other doctors with a metabolic health focus. What do you see about the cultural change that's happening? Where are you at in terms of how you're engaged with this cultural landscape, this changing of what is medicine?
Yeah, I'm very excited to see this, being talked about at those levels, and seeing politicians and the prominence of the discussion. But I caution people, don't wait for the government to do this for you. You need to take charge of your health. You need to be proactive about your health. And, one of the great ways to do that is go seek out, whether it's myself or one of the other great telemedicine, metabolic health focused doctors out there. Don't wait for the insurance company to say, okay, now we're going to cover metabolic health, because you might be waiting too long for that. You need to take charge. You need to take action, because it's your health that's on the line.
There's 762 people watching this live stream right now. Granted that your audience, Dr. Ovadia, is healthier on average than the average American. Of 762 people, let's just say they're all Americans. How many of those people are going to experience a heart attack in their lives on average?
Yeah, about a little less than half of them, I'll say, are going to experience a heart attack, and 25 to 30% of them are going to die from heart disease. It is the number one killer.
Let's do the math. Let's make it easy. 750 people on the live stream. You're saying that half of them are going to experience a cardiac event. That's 375. You're saying that 25% on the low end, that's 93 people on this call right now might die from a heart attack if you follow the averages for the nation. That's awful. That's how many school buses full of people watching this are going to die because there's this problem. And to what extent are heart attacks preventable from your point of view?
I think that at this point, I would say that 90% of heart attacks are fully preventable. And that might be a low end estimate, honestly. The factors that lead to heart disease, metabolic disease being first and foremost, is very reversible, very treatable, very preventable. And if we were to eliminate metabolic disease, the vast majority of heart attacks would be eliminated as well.
If 100 people watching this call right now are going to die of a heart attack, but 90 of you don't have to, 90 out of the 100 don't have to, if you change your behavior, that is why the team meetings with this team are lit every Monday afternoon, because we are excited and daunted by the responsibility, because that 90 of you dying of a heart attack when you don't have to, that is awful. And the fact that we're aligned with this Dr. Ovadia guy who can reduce that, make it 50, make it 40, make it 0. of the preventable heart attacks don't have to happen. That's why we're doing what we're doing at Ovadia Heart Health. If you've liked what you're hearing today, besides getting Dr. Ovadia's book, Step My Operating Table, always a good idea, we'd love to talk with you at ifixhearts.com/talk. What that looks like is we have an initial intake person you'll chat with about what you're facing, what kind of health issues you're facing. If it sounds like we might be able to help you out, then you talk with a second person on our metabolic coordination team who gets more of your details and goes and talks about all the things we could do for you and what's the right level of thing that we could do for you. If an initial consult seems like the right idea from there, what happens next is you get here on Lisa's calendar. You also get on our health coach's calendar. And right now, Dr. Ovadia is scheduling for, what is it, Cherish? Is it January or is it February right now?
January.
Okay, so if you bought today, you'd be talking to Doc in January. You'd have 3 or 4 months of working with health coaches, working with Lisa, getting all your ducks in or numbers wise. Lisa's probably going to say, okay, thanks for the lab work you just submitted to me, but I also want to see X, Y, and Z. Like she said to me with this other thing I never even heard of before, saying, go get that measured, then come talk to me after that. So it's a long process, which is actually good, because by the time you talk to Dr. Ovadia, he says that a lot of people he talks to, the initial thing they talked about with our care team when they first called us, it's often different than it was when they first started talking to us, because by being with our health coaches, with Lisa, maybe also in our community, that their behaviors already changed and their outcomes have already changed, even before you talk to Dr. Ovadia for the first time. So we're booking for January right now. We also have programs for businesses. And if you think about, I really can't afford healthcare that's not paid for by insurance, we also have some other options for you about a community that we run and some other ways to support you, some courses, all kinds of other stuff. So ifixhearts.com/talk is the place to go ahead and begin that conversation with our team. And Dr. Ovadia's internet is back. So let's round out this live stream with Dr. Ovadia. Let's imagine, who knows when this is ever going to happen, but let's imagine it's the day that you retire, that you hang up your white lab coat, you hang up your stethoscope, whatever, your scalpel, whatever heart surgeons use, and you say, okay, I am done with this kind of productive part of my life. And you look back at the impact you've had. What do you see?
Yeah, our vision, our mission here is to prevent 1 million heart attacks. And what I want to see at the end of my career is that heart disease is no longer the #1 killer. That's really a goal that we have, that we can impact heart disease so profoundly that it is no longer the #1 killer as it has been for the past 70 years here in the U.S.
Beautiful. One last request, folks. If you have anybody in your life who is facing health issues, maybe they're heart related, maybe they're not, and you think that their insurance provided PCP situation is not really doing it for getting the job done, would you please go ahead and share this link, whether you're watching on LinkedIn, YouTube, Twitter, go ahead and share this with this person you care about and say, hey, I was watching this thing. Maybe it'd be a good fit for you. Now, we work primarily with Americans, but Dr. Ovadia, where in the world are we able to serve people?
Yeah, so we do have some options for international patients. We currently have patients in Europe, in Japan. And so if you are outside the U.S., don't let that, and we have patients in Canada, I should mention as well. So if you're outside the U.S., still feel free to reach out to our team and find out what the options are for you.
It's a big benefit of telemedicine. You don't have to fly to Florida to get care from Dr. Ovadia and her team. Lisa, in your hospital setting, people had to show up there to go ahead and get care from you. You've been on our team now for most of this year, for most of 2024. What have you experienced in terms of people's ability to get care without having to travel somewhere to get it, without being confined to who's locally available? What kind of impact are you seeing from that on people's health?
Oh, it's a lot better, because I think in the general, to be able to do telemedicine is the best way to get care. Obviously you have to have hands on some people, but with us, it's been a lot easier for people because they can do it from their home. So they don't have to worry about, getting stuck in traffic or dealing with, the weather or anything like that. So in general, I've been doing telemedicine for probably the last 4 years. And it's been great. And it's easier for the patients.
We have a question here from Gary, trying to get a test, but is not able to get it. Cherish, what should Gary do?
Well, Gary can contact our team and we'd be happy to help you out. Lisa also can do lab reviews if you are interested in that. But to give you some additional advice, there are options. You can actually go on Quest's website and order those tests for yourself. LabCorp does the same thing. And if you still are having difficulty, because some states restrict that, also depends on where you are. If that does happen, becoming a practice member or at least signing up for a lab review with our team, we can get you there.
Okay. Now you mentioned Lisa's lab review. For some folks, they don't actually need to talk to Dr. Ovadia. It's actually quite sufficient to go have Lisa look at what you have her order more labs for you, look at everything else. Lisa, can you tell us a bit about what that lab review experience looks like and how it's distinct from that initial consult experience we have in our practice?
So the lab review, they get our panel of labs, which is pretty extensive. A lot of the patients have never heard of the labs that we're testing and they don't know what they're for, but I do. That's what I do, right? So when they see me, it's not just all about the numbers. What I find out first is now this is an hour-long lab review, and it usually takes up to an hour to actually get a full lab review. It's not just going to your doctor and saying, oh, everything looks good, and they give you the thumbs up, because that really doesn't tell the patient, what is really going on the inside. So I usually get a little bit of a history, what they're eating, their exercise, the main lifestyle that they're doing now or what they did before. We talk about a few things, why they really wanted the lab results, the lab review, and we go over everything. And then I go test by test and why we order it, what it's showing me. And if it is something that's off, how can they improve that? So that is one thing that is different. So they actually walk away with a way that they actually feel more empowered. They have the ideas on what they can do to make those numbers better. But it's not about the numbers. It's really about improving your health. It's just we can use the markers to also watch what's going on and see those improve, which should show better metabolic health in general.
Dr. Ovadia, why should someone talk to a nurse practitioner when instead they could be talking to you?
Yeah, well, first of all, you're not just talking to any nurse practitioner. You're talking to Lisa, who's got expertise in all of this. And, the reality is that some people, may not have the very complex cardiac issues that, might require my expertise. Lisa can deal with all of the metabolic issues. You don't need the heart surgeon or the physician to do that. Nurse practitioners are very well qualified to deliver this type of care. And sometimes you're just not sure because many of Lisa's lab reviews, at the end, the recommendation is, yes, you are someone that would benefit from a full consult. And we're fine with that approach, right? We don't want to, we're not looking to put everyone into the full consult. Maybe people don't need that. Maybe they just need the guidance that comes from a comprehensive set of labs reviewed by a very knowledgeable practitioner. And that might be enough, and that's great. Like I said, we are busy enough, right? We're not looking to, oversell people into things that they don't need. And we've tried to craft our practice in a way that people get what they need, and you don't have to get, extra stuff if you don't need it. So that's the advantage of many people starting with a lab review with Lisa and then figuring out whether or not their problems, need the full consultation experience.
Here's a note from Chris thanking us for the information. You're most welcome, Chris. And then Paulette here is going to take action. When you go to that ifixhearts.com/talk page, you'll see a calendar where you can immediately book a time. There's no having to call. There's no having to wait to book a time to have that first conversation with our team. It's just at ifixhearts.com, and you'll immediately be able to book and be booked into our calendar within a minute or two to begin the process of talking with Lisa, to begin the process of talking with Dr. Ovadia. Thanks, folks, for joining us today. And thank you for being on our journey of helping to prevent 1 million heart attacks. We'll see you later.